Hey guys, it's Alicia. I'm back. Like I said last time, I was going to do a video after I finished my first week of classes. For those of you that don't know, I'm Alicia from the Midwest in Michigan. My first year of respiratory therapy school. So, first week was a good week. There's 3 classes this semester. We have class every day but Wednesday and Friday, which is nice. So let's get into a little bit more detail of what we covered, the books that we're using. One day I might come talk to you guys not in my pajamas. I have these big 2-inch binders for each of my classes. It was recommended for us to do by a couple of the 2-year students that came and spoke with us at orientation. Having some tea. Lady Grey, if you're interested, it's like Earl Grey, but it's not as robust. It's real good. It's my alternative because I'm not a coffee drinker. Okay, we have cardiopulmonary physiology. That class meets twice a week. These classes are long. I was in class, I think each class seems about 2.5 hours. Yesterday we had class from 8 to 10:30, and then the next one was from 11 to 1:55. So it's a lot. The cardiopulmonary pathophysiology class. That class uses, I got my books here. It's clinical manifestation and assessment of respiratory disease. The first day in class was yesterday just because classes didn't start until Tuesday because of the holiday. What we covered in class was kind of the histology of the upper and lower respiratory systems. She kind of went over the different areas. We talked about airflow as well. So that's what we covered in that class. This class also uses, let's see, the Egan's book. This is a big boy here. The Egan's book. This book is going to be used for both years. I actually had rented my books already before orientation, but it looks like I'll be needing to buy this one for sure. So yes, actually all 3 of the classes do refer to this book as well. So you're not going to want to lug this thing around, but you probably may need to lug it around to all your classes. Let's see, the other class that we had this week was respiratory basics, the therapeutic basics of respiratory. So this class actually has a lab with it. So in class we mostly went over the syllabus and grades, and we talked a little bit of how clinicals will work. In the lab, we actually kind of got right into things. So what we did in lab was we practiced doing vitals. We did an icebreaker, of course. Let's see. We also learned how to assist with intubation. So we'll learn how to assist with intubation. They said in the second year we will actually learn how to do intubations. When we first got in the class, they had a mannequin set up in the simulation room that we were in, and they just kind of tried to have us assess the patient to see what we need to do to revive the patient, and the patient died. And it was just an activity just to show that when we come back in the winter semester, they'll have a summer scenario and we'll know exactly what we need to do. So it was just kind of it was fun. It was, so we were up most of the class. The teachers are real cool. More tea. Let's see. The third and final class is going to be pharmacology for respiratory care. And this class is going to be pretty dense. We have a quiz every week. There's actually a quiz next week. He also spoke about a essential drugs exam that we'll have to take, and it's an exam that everybody has to get 100% on. And you're allowed 4 attempts, but after each attempt, you're deducted like a percentage. So let's say you take it the first time, you don't get 100%. The second time you take it, you get 100%, but it's going to be recorded as you receiving 75, I believe 75%. Hold on, I got my syllabus right here. Let's see. It'll be considered you getting 95%. And then the fourth and final attempt, if you get 100, it'll be considered you getting 75% on the exam. And they said if it's past 4, then I think they need to talk with you and discuss what needs to happen next. What else do I want to say? I talked about attendance. If you miss 3 classes, more than 3 classes, they'll need to talk with you because there's a potential of you possibly being removed from the program. I'm sorry, the books. So the book that you're going to need for the pharmacology class is Rouse, Respiratory Care Pharmacology. In that class, we did some slides. We talked about drug names, like the different. So you have the chemical name, the trade name, the official name, and so that's something we're going to be tested on to next week's quiz is going to be over determining which of the names is for which part of the classification of the drug name. And then also we did some math determining the therapeutic level of the medication. It was a good week. I've got some reading ahead of me. That's probably a lot of bad. Get ready for my quiz. And this month I'm just going to focus on creating my personal study habits and just doing well. So yeah, thanks for listening. You can subscribe. I think there's a notification you can choose too.